Hey, how are you feeling? Mom told me you just got your first period. I know, it can feel very overwhelming the first time, especially because no one really talks about it openly. But I promise, your period really isn't scary or gross or embarrassing. And it's definitely not something you need to hide. Your period is a completely natural and normal process that almost 1.9 billion people go through every month. Well, Mom's a bit busy with dinner right now, so good thing I'm home for the weekend, huh? Guess you're stuck with me for a little longer. For now, though, why don't we focus on making you as comfortable as possible? We can do a bit of self-care, and I can answer any questions you have. Absolutely no judgment. How does that sound? Great. I see that you're still deciding between which period product to use. Want me to walk you through the options? When it comes to period products, there really isn't a one-size-fits-all answer. It really depends on what makes you feel the most comfortable and best suits your needs. What you're holding right now is a pad which sticks directly onto your underwear and absorbs the blood. These come in different sizes and absorbencies, like this longer one for heavier flow days, or this thin liner for lighter days. This one here even has wings to help it stay in place. Compared to the suspender belts that women used to hold up their pads a couple centuries ago, this sticky side makes pads much more convenient to wear, don't you think? Next, we have tampons, which are inserted in the vagina to absorb blood. Once it expands, it looks more like this. It might seem really intimidating at first, but it can be very comfortable once it's inserted properly. And it's convenient for when you want to swim or do more intense exercise on your period. Modern tampons are usually made of cotton or rayon, but a variety of materials were used historically. For example, women used papyrus in ancient Egypt, paper in Japan, lint tied around wood in Greece, and native plants in Africa and Hawaii. We've come a long way, haven't we? Unfortunately, however, not everyone is able to access period products and places to safely and privately change or wash with clean water. It is estimated that about 500 million women and girls across the world experience these barriers to menstrual health and hygiene, which can cause them to stay home from work or school. That's why free period product programs in schools and workplaces are so important. I actually grabbed this tampon from the bathroom of my university's library. Menstruation shouldn't be something that holds anyone back. What have you heard about tampons? Well, the myth that tampons take your virginity has discouraged some people from using them, but that's all it is, a myth. Virginity is a social concept in many cultures and religions that does not have a medical definition. There is no way to scientifically determine if someone is a virgin just by looking at the shape of their hymen. So rest assured that tampons are nothing more than a potentially helpful tool for you to experience your period how you want to. Now, some of the non-disposable, more environmentally friendly options are period underwear and menstrual cups or discs. Period underwear is like normal underwear with extra absorbent layers. Meanwhile, menstrual cups and discs are made of medical-grade silicone, and they're inserted like a tampon, but they collect blood instead of absorbing it. These can usually stay in your body for a little longer than tampons, but for any product that's inserted internally, it's really important to change them on time to avoid toxic shock syndrome. Have you heard of that before? No? That's okay. I'll explain. Toxic shock syndrome during menstruation is a rare and potentially deadly condition that isn't directly caused by the tampon, but the toxin produced by Staphylococcus or Streptococcus bacteria in the vagina. This results in an excessive immune response from the body, and symptoms like high fever, rash, or low blood pressure. Hormonal changes before a period lead to an ideal chemical environment for these bacteria to increase their numbers. Scientists also think that the oxygen introduced by tampons might be used by the bacteria to grow. What do I mean by hormone changes? Well, I'm so glad you asked, because I'll take this chance to tell you about how the menstrual cycle works. The menstrual cycle is the process your body takes to prepare for pregnancy, and it lasts an average of 28 days, although it can range from 21 to 45 days in some women. Menstruation, or what you know as your period, is when the lining of the uterus sheds and passes out of your body, along with some blood, if pregnancy does not occur. This usually takes about 3 to 7 days. During the menstrual cycle, changes happen in both the ovaries and uterus. In the ovarian cycle, the 3 phases are the follicular phase, ovulation, and the luteal phase. In the uterine cycle, the 3 phases are menses, or menstruation, the proliferative phase, and the secretory phase. The follicular phase corresponds with the proliferative phase, and luteal with the secretory phase. Returning to what I hinted at earlier, there are 5 main hormones that control these cycles: gonadotrophin-releasing hormone, or GnRH, luteinizing hormone, or LH, follicle-stimulating hormone, or FSH, estrogen, and progesterone. As you'll notice, estrogen is more dominant in the follicular phase, while progesterone is more dominant in the luteal phase. Essentially, low levels of estrogen and progesterone at the start of your cycle cause GnRH from the hypothalamus of your brain to increase the release of LH and FSH from the anterior pituitary. FSH then causes a group of follicles in the ovary containing your eggs to grow, as well as the production of estrogen. Estrogen also causes the lining of the uterus to grow and thicken, which is the proliferative phase. Something called negative feedback starts to happen. In this case, the more estrogen there is, the less LH and FSH are released. Right before ovulation, estrogen peaks. Around this time, only one follicle, called the dominant follicle, is still developing and starts releasing progesterone with estrogen. The peak in estrogen also leads to a peak in LH when the negative feedback switches to positive feedback, which triggers the final steps that result in ovulation. Ovulation is when the egg bursts out of the follicle and starts to travel through the fallopian tube to the uterus. This usually occurs halfway through the cycle, so day 14 in a 28-day cycle. After ovulation, the follicle turns into the corpus luteum, which begins to produce progesterone and estrogen. These hormones then signal for LH and FSH to stop being released, which causes this decrease here. Progesterone causes the uterus to continue preparing for pregnancy in the secretory phase. However, if pregnancy does not occur, the corpus luteum degenerates, causing this decrease in estrogen and progesterone. The decrease in these hormones results in the death of the surface cells in the lining of the uterus, a layer which the uterus eventually sheds when menstruation begins. Actually, it takes most girls several years after their first period, or menarche, to begin consistently having menstrual cycles with ovulation. I didn't learn this until very recently, and it surprised me, but that just goes to show the importance of menstrual education for all ages. Speaking of menarche, did you know that some cultures celebrate it as a rite of passage, or even empowerment? For example, For the Hoopa people of Northern California, menarche was celebrated with a ceremony that included dance and bathing in lucky spots because menstruation was associated with power and luck, considered an important part of their spirituality and culture. However, not all cultures share this view on menarche or menstruation. In many cultures, both modern and historically, taboos based on the fear of menstrual fluid as something unpleasant, contaminating, or even dangerous led to physical, social, and spiritual restrictions on menstruating women, like forced isolation in separate huts or being unable to prepare food for others. In North America, for example, menstrual taboos shape how we negatively view and speak about not only menstruation, but our own bodies as something shameful or embarrassing that needs to be hidden and managed. As a result, a lot of mothers are uncomfortable discussing menstruation with their daughters and leave them feeling unprepared. Alright, let me get down from my soapbox for now and check in on you. How are you feeling? Do you have any questions for me? You want to know what this PMS you've been hearing about is. PMS, or hey, go easy on my hairbrush. You know what? Let me do it for you. Anyways, where was I? Right. PMS, or premenstrual syndrome, is a common disorder related to the hormonal fluctuations of the menstrual cycle. If you have PMS, you might notice physical and emotional symptoms during the luteal phase after ovulation that significantly affect your quality of life. The severe form of PMS is PMDD, or premenstrual dysphoric disorder, and includes symptoms you might have heard of like depression, anxiety, mood swings, breast tenderness, or bloating. You would think that we know what exactly causes PMS and PMDD after thousands of years, right? No, scientists still don't fully understand why some women develop these premenstrual disorders. You're so right. Part of the reason why there's limited research on menstrual health is because of the stigma associated with menstruation. What about pain during your period? Well, that's what we call dysmenorrhea. There are two types. Primary dysmenorrhea is period pain that isn't caused by any other underlying condition, while secondary dysmenorrhea is linked to conditions like endometriosis. Not everyone experiences pain during the period, but it is often underreported. In about 15% of women, menstrual pain is severe enough to cause absences from work or school. Have I ever had it before? Absolutely. And I'm always trying out different ways to manage it. Why don't we do some self-care together? You might find something that works for you, or at the very least makes you feel a little better right now. Let's start with some skincare. Since we can't wash your face right now, I'm using this antibacterial spray first. You've probably heard that some people get acne flare-ups before their period, which is partly caused by, you guessed it, hormonal changes. As we learned earlier, high levels of estrogen and androgens like testosterone during the follicular phase cause your skin to produce more lipids like sebum and more microorganisms, including bacteria, that live on our skin. Low levels of progesterone, which block androgens from acting on our body, also contribute to these breakouts. Although skincare can't alter your hormones like birth control can, it can help us keep our skin barrier as healthy and hydrated as possible. This sheet mask contains madecassoside, which has anti-inflammatory and hydration properties, and is a component of Centella asiatica, a popular ingredient for skincare products in Asia. While we let that mask absorb, let's talk about some self-care practices that women and girls around the world use to manage their menstrual pain. Studies have shown that most people don't seek medical help and prefer to rely on self-care. Unsurprisingly, over-the-counter pain medications are one of the most common pharmacological strategies. Non-steroidal anti-inflammatory medication, or NSAIDs, like ibuprofen, are also commonly recommended, but about 25% of women find that these are ineffective at reducing their menstrual pain. Many women also use non-pharmacological strategies, like herbal medicine, rest, heat therapy, and exercise instead of or with self-medication for various reasons, including concern over side effects, personal preference, or cultural traditions. Would you like to try a heat pad? Personally, this is one of my favorite self-care strategies, and I find it very effective. You want the electric blanket? Sure, let me set that up for you. Staying warm is actually a very important part of traditional Chinese medicine. There's an emphasis on avoiding cold drinks and having hot beverages instead, with warming ingredients like brown sugar and ginger. Speaking of which, can I interest you in any hot drinks? I've got brown sugar ginger tea, chamomile tea, and this blend with fennel, ginger, and peppermint. Great choice. Here you go. Ginger, in particular, has been used over the past several thousand years to treat different diseases in many cultures. For example, ginger was used in Italian folk medicine, along with fennel, saffron, chamomile, and many other plants that modern research has shown to have beneficial properties, like anti-inflammation and pain relief. In fact, many studies suggest that ginger is just as effective as NSAIDs for relieving menstrual pain. Another alternative is aromatherapy with essential oils, a practice used in traditional Iranian medicine. Essential oils from plants that have been shown to improve menstrual pain include lavender, rosemary, mint, and cinnamon. I've got my diffuser here, and I picked this oil blend because it contains lavender and cinnamon. It smells nice, doesn't it? Now, I've also prepared a snack plate with iron-rich foods. There is beef jerky, sorry, no Wagyu steak for you, dried apricots, and chocolate-covered raisins here. You probably already know that red meats are a source of heme iron, which is the form more easily absorbed by our bodies. But did you know that pairing non-heme iron with vitamin C, like these dried apricots here, can help your body absorb it better? Why is it so important to make sure your body has enough iron? Well, it's an essential mineral that plays an important role in transporting oxygen in your blood, your energy levels, and brain health. Anemia due to iron deficiency is very common among women and girls who menstruate. Those who experience heavy menstrual bleeding are particularly at risk, but many women and girls are unaware that their periods are abnormally heavy due to the stigma and normalization of menstrual symptoms. If you ever feel extra exhausted, weak, dizzy, or even experiencing hair loss during your period, you should check with your doctor because these could be signs of low iron levels. For most people, an iron-rich diet is enough to maintain healthy levels of iron, but those with iron deficiencies may need supplements. Okay, so we've talked about herbal medicines, hydration, and nutrition now. But there's still one self-care strategy that always gets mixed reactions. Exercise. I know. When you're dealing with cramps, bloating, and fatigue, going for a run or hitting the gym is probably the last thing you want to do. Trust me, I'm practically married to my bed on my period. But what if I told you that exercise might actually help relieve period pain? Research suggests that many different types of exercise can significantly reduce menstrual pain. For example, one study suggests that resistance and stretching exercises were best for improving menstrual symptoms in general, while core strengthening was specifically effective in reducing the duration of pain. Another study suggests that low-intensity exercise like yoga and stretching provides the most benefit. Besides regulating hormones and decreasing inflammation in the body, research also proposes that exercise might improve changes in mood that may be even more distressing than the pain itself. But how does menstruation affect our ability to exercise? Current research suggests that it depends on the individual. One study shows that exercise performance may be slightly worse during the early follicular phase when both estrogen and progesterone are low. However, this difference is small and unlikely to be significant for most of the general population. Instead, the researchers recommended that exercise should be personalized to suit each person rather than following a universal approach. So, what have you learned today? Do you feel more prepared for your next period? There's no rush, you've got lots of time to experiment with what works best for you. Now, if you'll excuse me, I'm off to enjoy the rest of this beef jerky with the heating pad in bed. If you found this video helpful, please share it because everyone deserves stigma-free menstrual education. Feel free to comment your favorite menstruation fact or self-care ritual. Thanks for watching!